Welcome back. We are following a health alert for expectant mothers, or really anyone thinking about having kids in the future. A new study found women who had miscarriages between 2010 and 2012 were more likely to have back-to-back flu shots. Now, those shots included protection against swine flu. Even with this new information, healthcare professionals want more research, and they also do not want to deter pregnant women from getting the flu shot. I know a lot of women out there are questioning this because they are asked to get the flu shot. Dr. Chandra Adams with Full Circle Women's Care joins us this morning to kind of hash this out. You know, I remember being pregnant, and I remember them saying, get the flu shot. And I was a little skeptical about it, even though they said the benefit outweigh the risk.
Absolutely, absolutely, and that's still what we're saying. This study is really just a conversation starter. Okay. They looked at two different groups with two different outcomes and then compared it with some preceding behavior within a certain amount of time. They could have been looking at anything, and the important thing to remember is that link doesn't necessarily, or association doesn't necessarily determine causality.
So you think the sample size needs to grow and that this should continue to be a conversation, but at this point, with flu season coming up, you don't want women to say they don't want the shot.
Absolutely. These numbers just aren't big enough to make a conclusion. It was only like 500 women in each group, and out of those groups, maybe 17 had that particular outcome that they were looking at.
So, you know, when you're thinking about having a healthy pregnancy, you know, there are certain things that you should not do. But flu shot is definitely something that you encourage. And then when you think about if you've had it in the years prior to, is there a concern there?
Well, again, looking at the study, like you said, it was from 2010 to 2012. The flu shot changes every year based on what last year's was. And so you can't really extrapolate it to what's going to happen this year.
All right. So ladies, you know, if you're pregnant or thinking of it, the idea is still the benefit of the flu shot does outweigh the risk. You know, I want to quickly talk about some pictures that have surfaced from Naval Hospital, Jacksonville. Nurses potentially showing a baby, a newborn baby, making this baby dance. There was also a picture where they're calling baby mini Satans. I want to talk about this because you said that this hospital should never have had those babies out of the room with the mom in the first place.
Only under extenuating circumstances. NAS is actually considered to be a baby-friendly hospital, which operates under the principles that babies are supposed to be rooming in with mom 24 hours a day. It's encouraged that all procedures are done in the room with the parents. There are only two baby-friendly hospitals in the city, the Naval Hospital in St. Vincent Southside, and it's just surprising that this baby was kind of hanging out at the desk.
Right. And it's not because the baby could be in danger or something like that could happen, but it's really encouraging the mom to always be with that baby, to have that bonding time in those first few days.
And it's to encourage breastfeeding. We found that babies that stay near their mothers are more likely to be breastfed.
Right. And in the end, though, if you are at a hospital where they do take your baby to do certain tests, I mean, this is so rare. You know, moms should not be concerned that this is happening rampant throughout hospitals.
Absolutely. I've worked at several hospitals, and labor and delivery nurses are typically some of the kindest people and just most gentle and loving people with your babies that you find.
Yeah, but we do have some parents that are concerned, and they do have the right to keep that baby in the room to get those tests done. They can say, okay, I'd rather do them in the room.
Right. If a test can be done in the room, a parent does have the right to ask if it can be done in their presence.
All right. So again, all the stuff, definitely talk with your doctor about it and find out what's best for your family. Thank you so much, Dr. Adams, for coming in.
Thank you.
All right.